from foster care. This is sometimes also called public adoption, where children are removed from their first family often because of abuse and neglect or substance use. And even though reunification is always the goal in foster care, for most kids, sometimes that for safety or for a variety of reasons can't happen, and so kids can be adopted from that system as well. And then international adoption, or inter-country adoption. So this is where kids of a variety of ages are adopted into the US. The US is actually one of the only countries that's both a sending and receiving country for international adoption. So we'll talk a bit about kind of trends in that in just a minute. The best data we have on like how many adopted persons are there in the US is actually from the most recent census data. That's there's aspects of census data that are actually collected each year. So for the most recent set of data that we have, about 2.2% of kids under the age of 18 currently living in the US are adopted. This is actually down a little bit. So the census data from 2000, it was 2.5. So adoptions are decreasing a little bit overall, and you can kind of see that here. So with the dark blue line on the top is all adoptions. And so this is from 1940 all the way to, I think the most recent data on here is 2016. So you can see there's kind of fluctuations over time. If we look at the 3 different types of adoptions that we talked about, you can see that like international adoption is in green on the bottom. And so you can see there's obviously been fluctuations that really peaked in the early 2000s and has been pretty dramatically decreasing since that time. Whereas the private adoption, which is the purple line, was a much higher. We don't have data from before, but it was the most predominant type of adoption before 1960, 1970. And you see it kind of steadily decreasing, whereas foster adoption or public adoption is the red line, and you can see a big increase that occurs. And that's because of both some legislative and some policy things that made it easier to adopt kids out of foster care. So yeah, I'll pause. Any questions about kind of some of those trends you're wondering about? Good so far? Okay. So just because I know you're probably encountering a lot of adopted kids, especially in West Michigan. There's quite a bit of international adoption relative to other places. So I thought you might be interested to kind of see how the fluctuations of this are occurring. So this is data from like 1999 to current, and you can see that there's been real shifts both in like the overall numbers, so you can see a big drop, but also in the places where kids are coming from. And so at various points in time, different countries have closed. So Guatemala, for example, closed around 2010, Russia closed around 2014. And so you see kind of drops in those particular countries, but still currently the most common places where kids are internationally adopted from is China in the US for any single country. Because we're at All Belong, we're also really interested in kind of the intersection of adoption and disability. And so again, from that US Census data, about 12% of kids have a disability as defined by the ADA. But if you look at different types of adopted kiddos, where they're adopted from, then that shifts a bit. So about a third of kids who are in foster care or who have spent time in orphanage care or other institutional care have a diagnosed disability, and that's all in comparison to about 6% in the general population. So we're more likely to encounter, if you're working in inclusion services, you're more likely, adopted kids will be overrepresented among the kids that you serve. And what's interesting is that this has changed quite a bit, and I think it's based on the trends only going to be increasing. So adoption way at the beginning, when it first started legally anyway, was all about finding kids for families. And so it was usually couples adopting a healthy infant. And that was kind of the trend there from like 1900 to 1960 or so. Then around 60, 70, there was a real drop in the number of infants that were relinquished. And that trend has kind of continued. And so there was a big move to increase international adoption at that time, mostly from Korea in the 60s, 70s, and then also foster care adoption. And so because of that, kids had more early risk factors. And so we had started seeing a higher risk of kids with diagnoses in the adopted population. And then that's only increased really since 1990 with changes in where kids are being adopted from. So Romania, for example, was a real common place in the 90s with kind of the accompanying difficult orphanage care that those kids received. And kids coming internationally are older and older. The infants and toddlers are not adopted internationally much anymore. Changes in laws mean that they're more likely to be adopted domestically in their birth country. And so instead, the kids that are coming are older or have special health care or other placement needs. And so I think we're just going to see kind of an increase there. And so it speaks to the urgency of understanding some of the things that are facing these kiddos. This is some data from Health and Human Services. And so this is looking at like what kinds of disabilities are more common. So this is comparing all kids, like non-adopted kids are the darker bar here, and adopted children are light blue. And so we can see the highest bars there are doing great, like not experiencing trouble, of course. And we'll talk a little bit about the fact that as a whole, if you look at averages, adopted kids are doing really well. If we look at some specific behaviors that we might see, where we see a real increases, diagnoses of ADHD, and then externalizing things like conduct problems. I'll go into more detail about that a little bit later. And then this divides it up by type of adoption. So you can see that private domestic, so those infants, are the light blue line, and in general that for most of the time is the lower line, whereas kids who've experienced foster care seem to have a relatively higher risk for diagnoses or challenges behaviorally. So the last thing I wanted to kind of say in this section is just speak to some of the trends that I'm seeing, especially over the last couple of years. One of the biggest is in the last probably 50 years or so is a shift from closed adoption to open adoption. So when adoption first started, there was quite a bit of secrecy around it. Sometimes people who were adopted were not even told they were adopted. And so there was not a lot of contact, for example, between adopted persons and their birth relatives of any kind. So there's been, in the last 50 years, quite a big shift and push toward more open adoptions and more contact. And I think intuitively back before there was open adoption, people were concerned that kids would be confused or that there would be difficult relationships between birth and adoptive relatives in terms of managing kiddos. And the research hasn't suggested that that's actually been the case. So there's actually quite good outcomes with open adoption and continued contact, but that contact ranges widely. So for some people, it's just sending letters or pictures. For others, it's regular in-person meetings. So it ranges widely, but there's quite a bit of more contact and openness in adoption now. And with that comes some shifts in terminology too. So you'll hear me use this phrase of adoption kinship network. That refers to all the people around the adopted person. So the adopted person, their adoptive family, and their birth relatives are all part of this kind of adoption kinship network. Sometimes we talk about it as maybe a slightly older term was adoption triad, where like the adopted person, their adoptive family, and their birth family were on the 3 different points. But with more openness, we're starting to see a lot of relationships like birth grandparents and birth aunts and uncles and birth cousins. And so it's just recognizing that we have a much more complicated definition of family right now. And then the other piece, and this is maybe a newer move, is calling birth relatives first family. Not everybody uses that terminology, but increasingly I'm hearing that, especially from adult adoptees, as they talk about their family, they call them their first family. Another piece that's related to this contact thing is that older adoptees who maybe didn't have contact as a part of their adoption have new avenues for reunion or search with birth family. So direct to home DNA testing, for example, social media, the internet, there's just many more ways for people to find out more about their origins, defined broadly. So there's quite a bit of new research on the ethics of all of that. And with that, I think comes a greater, especially in the last 50 years or so, a greater recognition of some of the ethical tensions in adoption. For example, there's more publicized about the coercion that sometimes occurred in the early 1900s, or even child trafficking that happened in Guatemala. So there's just much more of a recognition that adoption is complicated ethically, and we have to have discussions about that. In the last 30, 40 years, there's a huge increase in transracial placements. Those did not happen much in the early history of adoption. Now they're about 30 to 40% of adoptions are transracial placements. So there's a big increase in that. And just a movement towards adoption from a variety of family forms. So singles, adopting. So those are sort of my big, when I look at the field of adoption, those are the big things that are changing. Yeah, so I'll pause a sec. Anything you wanted to ask about any of that before I move into some of the experiences of kids? Good? You guys are all warm and tired on the day? All right. So let's talk a little bit about adverse childhood experiences and also really supporting resilience with the kids that we're serving. I have a few disclaimers to kind of keep in mind first. We can't obviously assume that adopted kids necessarily have experienced these. Many have, especially those who've been adopted through foster care or through institutional care. But even when the kids have experienced these, the majority of adoptees are doing quite well, are very resilient. And at the same time, there's a huge variability in outcomes. So some kids, and maybe you've seen this in your own experience, but some kids who've experienced a ton of adversity seem to be like surprisingly resilient. Wow, this seems fairly unaffected. And at the same time, other kids who maybe have had somewhat less significant adversities are really struggling. And so it's sometimes hard to predict for an individual kid, how things are going to go. I'll just super quickly review the research on adverse childhood experiences, or ACEs. This might be a topic. Who's heard of the ACEs research? A couple? Okay, perfect. So the ACEs research happened in the 1990s, or started then, and has exploded since then. But it started as a questionnaire that asked people about these things that I have listed here. So they just asked, before you were the age of 18, did you experience any of these things, yes or no? So abuse, different categories, neglect, and then household challenges. I'm going to focus just on the abuse neglect piece of this. But what that research back in the 90s found is that adverse childhood experiences are shockingly common. So you can see these are the abuse and neglect percentages of people who have experienced these divided by gender. But if you look at the total, somewhere between like 10 and 30% of people said, yes, I've experienced these before the age of 18. And this is general population, I should say, this is not specific to adoptees. This is in the general population. They also found that these were really, when a person had one of these risk factors, they often had more than one. So this is how many people had 0 all the way to 4 or more of those different things that were on the list. And you can see that 15% of people had 4 or more of those things on that list. And only about 40% had none of them. So 60% of people have at least one of these. So that just suggests to us that these adverse childhood experiences are quite common in the general population. The research that has followed has really linked these adverse childhood experiences in sort of two different directions. They've identified what kinds of social conditions and neighborhood factors seem to increase the chance that kids will experience these. And then it also follows kids over time to look at the impact that it has on their brain development, on their functioning in social and cognitive areas. And then also this research has gone in the direction of health and looked at like health behaviors and health conditions. And really what it seemed to find is that adverse childhood experiences are linked with a number of different long-term risk factors in mental health and physical health, in health behaviors. So. I love the dogs. Awesome. Okay. So the ACEs research is what we call a cumulative risk factor model. So it just counts up how many of these people have, and it looks at their impact as a whole, you know, and they really find, okay, if people have 4 or more of these, that's really where the risk factors come. But it doesn't look at the specific impact of individual risk factors and how might they work. So what's sort of been the direction the field is moving in is more of what we call a dimensional model, where we say, okay, now we really want to understand the impact of specific kinds of these adversities. Like, what's the impact of neglect versus abuse? Like, are there different pathways? Are there different ways that we could support kids if they have one of these but not the other? That kind of thing. And so the dimensions that we'll be talking about are deprivation. So that can range from kind of high to low, and threat, high to low. And so a typical and ideal developmental environment would be one that's characterized by low deprivation and low threat, right? Like we want to end up here. Whereas if kids are experiencing a lot of neglect, then they're going to be high on the deprivation, but not necessarily high on threat if neglect is kind of their main experience. Or if we have kids who are experiencing abuse, they're high on threat, but not necessarily high on deprivation. Institutionalization is this spot where it can be both neglect because there's not a lot of caregivers for kids in orphanage settings, and because they're really vulnerable to abuse in those settings as well. So I'm going to take kind of one dimension at a time. Let's start with the deprivation one. So deprivation can range on a spectrum. And so I thought it would be helpful to kind of think about it as a continuation. I mean, we all have, you know, I'm thinking especially in COVID, right? We're not always like, if we have kids at home, we're not able to always give them 100% of our attention at all waking hours, right? But that's okay, no intervention needed, because actually it can be growth promoting. And that's what I tell myself when I feel guilty about, you know, not always being able to, when I have to work when my kids are home, right? But as we move further along the spectrum, you start to see chronic understimulation, where kids are just not getting a lot of interaction. And then we would say more of a severe neglect in a family context where the kids are really totally fending for themselves and not really being kept safe by their caregivers. And then maybe the most severest form of neglect is the type of neglect that would happen in an orphanage or an institutional setting, where even some of the very basic survival needs might not be met, right? So we're probably focusing, as I keep going, on the 2 columns on the most severe end. So when that happens, when we have deprivation, we say what's going on in the child development is that it's a lack of expected inputs into the environment. And that could be cognitive stimulation like language. It could be social stimulation like interacting with parents and peers in a structured way. But when there's this lack of caregiver scaffolding, like so much of child development depends on the caregiver kind of not doing things for the kid, but being there to check in with and point things out and make suggestions. And all of that, the research suggests, tends to reduce the cognitive and linguistic complexity of the inputs that the kids are getting. And we have really good research that tracks the impact of that on neurodevelopment. It seems to impact the areas of the brain that are most involved in specific cognitive areas, so language and executive functioning especially. So planning, problem solving, organizing, inhibition, those kind of things. And ultimately, those things actually increase that lack of, or that change in neurodevelopment increases kids' risk for internalizing symptoms like depression or anxiety, and externalizing symptoms like hyperactivity and conduct kinds of things that we could see. So that's sort of the pathway by which this tends to work. In terms of the neurodevelopment stuff, when you have that lack of response contingent caregiving, where the caregiver is responding to the child as they need something. So I'm hungry, will you give me food now? Rather than at an orphanage setting where it's like lunch is at noon, like it or not, you know? So when the caregiving isn't responsive to the child, you see a reduced thickness in the cortex of these association areas, the areas that are pink. Association areas are where all the integration in the brain is occurring and the most complex level thinking. And so those areas are less thick, and the dendrites which is part of the neuron, are less branched. They're a little bit more simple. So maybe easier to see on your handout, but column A, so the ones on the left are from a non-enriched environment, so a depriving environment, whereas the column on the right there is from an enriched or typical environment. And you can see that there's just many more branches, kind of picture it like a tree. There's just many more branches there on that right column. And that's all speaking to the complexity of experience that child has. So when you get a lot of language input and a lot of social input, you get that rich branching that you see. The other thing that it affects is pruning. So we're born with all the neurons we're ever going to have, actually, except for like two small exceptions. And they're mostly in the place where they're going to be. But what happens as we have experiences is those neurons form connections with each other. And as you age, you actually prune away the neurons and the connections that you're not using. And it makes you more efficient at the stuff that you need to do. So it's a good thing. But if you prune based on experience, so the stuff you're using, the brain wants to keep. The stuff you're not using, it will kind of prune away. So this was fun to pull up from graduate school. I had to go digging for this, but this was a study I did over at Children's Hospital in Michigan. The picture on the left is the connections between the frontal lobe and the striatum, which underlie attention, executive functioning stuff. And picture A is from a control kiddo, a kid who had a typical rearing environment. Picture B is from a kiddo who had orphanage rearing. And so you can see this like a very dense and well-organized pathway for picture A, and then a much more distributed, diffuse, kind of less efficient pathway for B. And so what's happening there is a problem with pruning because of a lack of experience. And so attention and executive functioning are just not going to be as efficient and well-organized for that kiddo because the experiences that they had didn't help their brain prune in the way that we would want it to. So that's deprivation. Anything folks want to ask me about that one before I move to threat?
So Ellie, how many adoptions at this point happen from institutionalized care? Because not as many countries do institutionalized care anymore.
Yeah, most of the kids that are internationally adopted now are coming from institutional care. So most of the countries are still doing that. So like China, for example, still has institutional care. A number of the countries from Africa that are still have adoptions to the US do have institutional care too. Yeah, so most.
Okay.
Mm-hmm. Yeah. But this, I would say this too mirrors what we'd see with kids who have deprivation in a family context too. Yeah, a lot of the findings are pretty similar. So now let's talk about the other part of that dimension, right? We said deprivation could be high or low. Now threat can be high or low. So by threat, I mean experiences where the child themselves was harmed or where there was a threat of harm. So any sort of abuse would kind of fall under this umbrella of threat. The early experiences that kids have when they have exposure to violence in their home, even in their neighborhood, changes the way the brain develops. And you can kind of like marvel at the way the brain is developing. It's trying to keep that kid safe. But what it does is it alters in a way so that they can rapidly identify threats in their environment. So the parts of the brain that are like danger detectors, those are the ones that are developing, are maturing faster in those kids than what they do typically when that violence or threat exposure is not there. And it does keep the kids safe, like it's a safety mechanism, it's adaptive, but the problem is that that early maturity and that like difference in the way that it's maturing impacts the way they can regulate their own emotions, the way they process emotions in other people, the way that they use emotions to learn. So there's some real costs, even though it is a way that the brain is using to keep itself safe. And all of that leads to increased risk for those same kinds of symptoms, depression, anxiety, and aggression, conduct problems, hyperactivity. I'll just give you a couple, I mean, there's tons of research I could go into, but I'll give you a few examples to show you. So this is with kids who have threat and abuse experiences compared to kids without those experiences. And they're looking at both young kids and adolescents. And so this first one all the way to the left, that's the connections between the threat detector of the brain, the amygdala, and the frontal lobe, which is kind of the brakes, the emotion regulator. And you can see that typically as kids age, you see greater inhibition of the amygdala by the frontal lobe. So that bar goes down, more inhibition there. With kids who've experienced abuse, that's the right side of that graph, you see a very early maturation of that pathway, like it's already, already looking like adolescence compared to the typically developing kids. And so that early maturation. And then on the other side, that's the amygdala's responses to fearful faces. And you see in the comparison kiddos, the drop over time. And with the kids who've experienced abuse, that really high, like kind of the gas of emotions, the amygdala is really active when it's processing those fearful faces. Unfortunately, it works in the opposite direction too. And so for happy faces, you actually see decreased activation for kids who've experienced abuse when they view those happy faces in reward processing areas. So nucleus accumbens is a reward processing area. When you're hungry and you eat, it's active. When you are lonely and you interact with a friend, it's active. But for kids who've experienced abuse, they see happy faces as less rewarding from a neuro perspective. And that the level of that nucleus accumbens response to happy faces is correlated with depression symptoms. So the lower their nucleus accumbens responses to happy faces, the more depression symptoms they report. So there's just a lot of connections between these experiences, the brain development, and then the outcomes. So that's sort of the underlying mechanisms, the neglect and the abuse, but what kinds of things are you likely to see in the kids that you're experiencing? Maybe like as I say this, I'm hoping you're kind of thinking about some of the students that you're working with. But again, keep in mind, this is not all kids, right? So many adopted kids who, even those who've had these experiences, don't have these outcomes. But when they struggle in particular ways usually. So one area of really high risk is challenges with attention, executive functioning, inhibition, impulse control kinds of things. We actually used to call it inattentive overactive profile. We wanted to separate it from ADHD, but the symptoms are quite overlapping. We just think of it as maybe ADHD, but caused by their early experiences, essentially. The prevalence ranges depending on what population you're looking at. And so if you're looking at a group that's had pretty severe deprivation for a long time, it can be at least half of the kids will meet criteria for ADHD. But yeah, it's lower if a group has maybe had less deprivation or abuse. But again, it's strongly related to how long kids are there. So deprivation, especially for more than 2 years, and threat for more than 2 years tends to really increase risk for kids. If it's really, really bad abuse and neglect, it can even be 6 months of that can increase their risk. And there is some suggestion, this was some research that I did, that you might not see these things right after adoption in young children, but that they might emerge later as kids get into adolescence. So I was following kids for about 6 years, and through like late elementary into early middle for one study I was doing, and they were showing like increases in these problems over time rather than decreases. The other spot where you're, if adoptees do struggle, they do tend to struggle in language. Again, this is partly due to deprivation and lack of language experience. But for the most part, if you're like grouping everybody together, there's a small to medium negative impact on language for adoptees, especially those who've experienced abuse and neglect. Now, if you're looking at like, okay, what kind of language problems, for the most part, they tend to struggle more with the pragmatic social sides of language. So like understanding when something's serious or when it's sarcastic, non-literal kinds of language, just abstract language, how far away to stand from somebody, what's appropriate eye contact, like those pragmatic social aspects of language tend to be a little bit more challenging. And again, older age at adoption means longer time in those depriving environments and it increases risk. From an IQ and academic side of things, this is a really good study. It looked at kids who were in Romanian orphanages, so that would be like some of the most depriving orphanages we know, but it tends to depend on when they were adopted out of those settings. So the top line is kids who were adopted out of those settings at below 6 months, and it follows them from 4 to 6 to 11 to 16 years. And you can see their average IQ is about 100, so about kind of where we would expect. Kids who are in those settings from 6 to 24 months, you can see their average hovers between 80 and 90. Kids adopted from those settings after the age of 2 start out averaging around about 75, and then you do see an increase where they end up around 90 or so. So it seems like those settings cost kids about 10 IQ points or so from where we would expect them to be. So that's kind of the cognitive side. From a behavioral emotional side, again, you see some patterns. If kids struggle, they struggle in particular ways. This data looked at kids who had mild, moderate, and severe deprivation. So that's those first 3 columns, mild, moderate, severe, compared to a no deprivation group. So that 4th column there. And so what those percentages are the percent of kids who are scoring above clinical cutoff in particular areas, in internalizing like depression and anxiety, or in externalizing conduct problems, aggression, attention problems. So you can see still, like even in what's amazing to me is even in that column, the globally depriving, so like the most depriving settings, still the majority of kids are not scoring above clinical cutoff. So kids are really resilient even in those settings. But at the same time, if you look at mild to moderate to severe, you really see the attention problems and the conduct stuff really sticking out as if they struggle, that's where they struggle. Social relationships can be kind of challenging, both with caregivers and with peers. So The research suggests that kids who have experienced foster care, institutional care, are at increased risk to have a non-secure attachment with their caregiver. So you can see the kids coming out of institutional care on the top line there, and their distribution of percentages, and then the non-adopted group on the bottom. So for non-adopted kids, about 90% had a secure attachment with their caregiver, whereas that number was below 70% for the kids from institutional care. Still, 3/4 are doing well. There's just that increased risk for a much more disorganized kind of attachment from a caregiver, where they don't see that caregiver as like their special person, where that's their secure base. You see this in peers most often with disinhibited social behavior, where in little kids, you know, they with strangers, they'll come right up, grab their hand, sit in their lap. There's not that sense of like stranger danger that you kind of expect typically. And with as kids age with peers, you tend to see more disinhibited behavior, where maybe a little bit more, they're described as more clingy to their peers, or maybe that with internet, they're not making safe choices with internet interactions with strangers, that kind of thing. This data just follows kids over time and looks at, okay, after they're adopted, how does this change? Does it get better? And so you can see that it's about, like of the 130 people or so that they studied, it's kind of maybe roughly a third. And over time, those kind of dark, thick arrows show a lot of kids moving into the no disinhibition. So it does tend to get better, but there's still a good maybe 1/4 of their sample that's still showing at least mild disinhibition. So this is one of those things that seems a little more persistent over time. The other data there is just from a study of mine that showed how it interacted with attachment, but for time we can sail right through. One of the things that we didn't have a lot of research on was, okay, what about kids adopted at older ages, either from foster care or institutions? We had a lot of data for kids adopted as toddlers, and that's great and all, but the bigger percentage of kids that are adopted now internationally, especially, are older kids. They're coming at school age, you know, so maybe you're seeing a kid who's recently adopted at 8, and then now they're enrolled in school the next week, and good luck, right? So what do we know about how those kids are doing? So I did a study where I was looking at kids who were adopted at 8, a mean of 8, but above 5 was my cutoff. So we were looking at how things changed over time. And we looked at cognitive outcomes, behavioral emotional outcomes, and I followed them for three years. So they were, when they came, study visit 1 was about 1 year after they had been adopted. So they were about 9-ish. And then each study visit was 1 more year after that. And I just put these percentages here because I thought it might be helpful to know what to expect, like what percentage of kids are struggling in each area, and what would you expect to get better over time for these older kids as they get, like if they're internationally adopted, as they get more English, as they get more care in a family setting, versus what kinds of things tend to stay as a struggling area. And it's really that same pattern of attention, executive functioning, and language. If kids struggle, they tend to struggle in those areas. Those tend to recover a little bit less quickly for these older kids. Now, I told you there's a ton of variability in outcomes, right? And some of that is related to genetics, not all of it, but we each have a specific kind of genetic profile that's going to either increase or decrease our risk for different outcomes depending on our environment. We sometimes call this the dandelion orchid hypothesis, where some kids are dandelions. They're not very sensitive to their environment, whether they're growing in the middle of a lush yard or the crack on a sidewalk. They, you know, they come up, they flower, they do great. Other kids seem to be orchids. They're much more sensitive to their environment. So when they're in a good environment, they bloom and look beautiful and, you know, really do great. But when they're in a harsh environment, man, they really struggle. So it seems like depending on our genetic profile, we have these different levels of sensitivity to the environment. Tons of studies have replicated this, but this particular study looked at kids who were in orphanage care or not institutionalized. This is replicated in foster care too. But some kids are the dark gray bar where they're just a little bit less sensitive to their environment. And so whether they're in an institution or not, their outcomes for their frontal lobe thickness are about the same. Whereas some kids are those orchids and they're those light bars. And man, when they are in a family setting, never institutionalized, they do the best. Like they're the highest bar there, right? But when they're in an institutional care, they really struggle. They're the lowest bar. So some people we think are just more sensitive to their environment. And that might be some of what we're seeing with kind of the individual differences with how kids respond to what they're part of. So before I turn to like resiliency, we'll end this section on a more positive note, recovery. Any things you want to ask me about related to some of the things that we tend to see with kiddos? Does this jive with what you see with the kids that you're working with? Yeah. So what do we do, right, when these kids are struggling or when they've experienced these adverse childhood experiences like an abuse and neglect? How can we like do what we can to help them be resilient and recover after some of this trauma? Well, one of the really big pieces of good news, I think, and this is sort of newish research in the last 10 years, is that adolescence is a huge time for brain reorganization. So it not only is the outward body changing, right, in puberty, but so is your stress response. And the stress response is a key to some of the symptoms of depression, anxiety, some of the behavioral symptoms like inhibition, impulse control. And so there's a huge opportunity at adolescence if we can get kids in a supportive, enriched environment that, you know, it doesn't have a lot of stressful experiences and has a lot of warmth and care. That is a time when stress response can reorganize. It does, and Megan Gunner, who is at University of Minnesota, has some really exciting research about how that's happening in kids who've been in foster care or institutional care. So some kids do show improvement at adolescence because of that reorganization. So it's a good opportunity to act on that. When kids come from really depriving environments, either in family settings or in institutions, our top priority should be to increase the level of cognitive stimulation and kind of complexity that they're interacting with. So both in their family and at school, we should be giving them really complex language stimulation and novel and new things for them to interact with and problem solve with. They need that with our appropriate scaffolding, but they need that for their brain to develop properly. So the sooner they get it, the better it is. Because executive functioning, attention, and language are those key areas, all the accommodations that you all are implementing already for those things in the classroom would be key. The social support aspect, especially with peers, is something I'm quite interested in. So I have a study right now where we're implementing a social skills intervention for adopted teens, a 16-week intervention. The intervention itself was actually developed in the context of autism. So I think we can really give ourselves the freedom to pull from things that were developed for ADHD or were developed for autism or other things. But it's working really well in our kids who, many of them do not carry a diagnosis of autism. Their social challenges are related to some of their early experiences, but this intervention is working great. It's the peers intervention from UCLA. I don't know if anybody's had interaction with that one, but it stands for the Program for the, Evaluation and Enrichment of Relational Skills, but it's an acronym, PEERS. So there's a school-based version of it actually that you can do in a classroom setting. So we're really excited about the way that that intervention is hopefully allowing our teens that we're working with to develop more relationships with each other in the group. It's a group of 10 teens that work together, but also draw on broader support networks. That tends to buffer kids' risk for emotional problems when they have peers. It buffers them from bullying because they're not the solo person that's getting picked on by other people, and it can increase their self-esteem. As much as possible, when kids have had early stressful life experiences, we want to reduce their risk for later traumas. So anything that we can do to protect them from later stressful life events will be valuable. Ton of research to say that parents have a big role to play too in this resilience and recovery. So as much as they can convey to their child that they and increase the child's felt safety, sometimes kids after trauma engage in difficult behaviors, and it can push parents away or push parents' buttons. So as much as we can do to support parents to convey that felt safety and help the parents serve as a co-regulator for the child. And then the last thing, there's some really interesting new research out that helping especially adolescents have more emotional granularity, meaning like if you ask them, how are you feeling? And they just say good or bad, that's kind of low emotional granularity, right? But if we can help them be a little bit more specific about what sorts of emotions they're feeling. I really love this chart here. It's one of my favorites. I have one of these in my room when I do clinical work. It really can, if we give people a broader emotional vocabulary to talk about how they're feeling, that tends to actually increase people's coping and resiliency, even in the face of stressful life events. So there's even a really interesting study with COVID, actually, where they were looking at teens who had early abuse, neglect, and looking at them, okay, now in this stressful life experience, who's doing the best? And it was the ones with the most emotional granularity. So that sort of detail is helpful. So yeah, all right, so I'm gonna pause. Any questions folks wanna ask at this point? Good. I think we could all, a break is always good after we've been listening for an hour. It's nice to like stretch and get up. So why don't we take 5 minutes and we can stretch, get up if you need to check your phone or use the restroom. Yeah, I'm happy. I'll stick around if there's individual things, but we'll come back at, let's see, yeah, 1:57. All right. About grief, right? Like it's not maybe a healthy way to think like, oh, it's something I resolve and good to go, right? And so I really want, I think a more helpful perspective is to think about the fact that adoption is something that that adoptees and other members of the adoption kinship network are always processing at some level across the lifespan, and the questions that they're thinking about, the things they're curious about, the things that they're maybe grieving, if that's a part of it, are going to change depending on what life stage they're in. So, and some of it too depends on their cognitive capacity to understand and what developmental tasks they're involved in. So I thought I'd just go through these age groups since that's maybe who you're most likely to be interacting with. So in the preschool period, kids are really concrete thinkers, and they don't understand much about reproduction and birth at all. So kids in the preschool period, adopted kids especially, really often have a pretty hard time distinguishing between the difference between being an adopted person and being, raised in a birth family. Like that distinction is not really very clean often for kids in preschool. Those who were adopted from foster care, it might have some memories of their birth or first families. And so you might have some conversations there. They might have a slightly better understanding of the fact that I had a first family and now I'm in a new family. Like that sort of understanding might be there for kids who were like recently adopted from foster care and are in preschool. But for the most part, preschoolers don't have a real in-depth understanding of that. In early elementary, obviously, there's a little bit of an improved understanding of like family and how people come into families, and like differentiating between adoptive and birth families starts to happen a little bit here. There's also a beginning understanding in the early elementary period of loss, and for some kids, some feelings of abandonment that might come with that. There's more research on that in kids in like domestic infant adoption with that theme. Another common thing that early elementary kids who are adopted do is think about and fantasize about birth relatives, especially if there's limited contact. There's often a very rich imagination world. Some of the adult adoptees that write about this call it the ghost kingdom, this like kingdom of relatives that they are imagining in their mind. And what would it be like if? So there's a lot of those questions of like, what would my life have been like if, those kinds of things. They're also in early elementary starting to ask some questions about the reasons for their adoption. So the reasons for their, why their birth family might have relinquished them. You might start to see some experiences of grief at this stage. So the early elementary is when kids actually do start to get a little bit more of this cognitively. In upper elementary, you just see a continuation, a lot of these themes. So there's continued improved understanding about adoption and reproduction and birth. And so they just get a little bit more of some of the concepts. They're thinking a little bit slightly more abstractly. One of the big things in upper elementary is this beginning formation of like self-esteem, self-concept, identity, like that's just starting. And so often at this upper elementary, I see, and the research suggests kids really want to fit in. They don't want to be different. And so adopted kids might not want to talk so much about their adoption necessarily. You know, this is overgeneralization. Kids will vary, but they might want to just be seen like everybody else. And so anything that draws attention to their difference might be, they might not like so much. As kids transition into adolescence, again, they just get this more abstract thinking generally. And so it allows them to think more carefully through some of the ethical tensions that are inherent in adoption. And so they might start to question some of the systems and things that were in place that, that may have been behind the reasons why they were not able to be cared for by their birth parents. They start to understand, do better perspective taking. And so they can think through the different perspectives of birth relatives, adoptive parents a little bit better. And then you have this continued identity development that happens. In adolescence, I see this a lot more, especially with kids who are transracially adopted, that they're working on developing a healthy sense of racial or ethnic identity, and that that adoptive families need to do some extra work around that to help them develop that healthy racial and ethnic identity development. If they are not, it requires more explicit work if the parents are not of the same race or ethnicity. So that kind of trajectory tells you what kinds of things are kids thinking about or working on with adoption. The other thing I thought about, okay, if I have an inclusive school, some of it's like just language use around adoption. So there are some phrases that people sometimes use about adoption that convey some negative messages. They may not always intend them to convey a negative message, right? Often this is very unintentional, but I always caution folks against this idea of like give up, give away. It sort of conveys this message of being discarded, unwanted. The whole put up for adoption actually comes from orphan trains, where kids would be taken from the east and shipped out to the west on trains and put up on stages or stumps for prospective adoptive families to say like, yeah, I want you to work on my farm kind of thing. Again, that's not how people intend it when they use it today, but language like place for adoption or make an adoption plan, like the birth parent made an adoption plan, just has a much different connotation for kids. I hear this all the time from kids where other kids say like, who are your real parents? You know, so we have that language that other kids and sometimes other adults use. We always kind of practice how to respond to that. And usually I tell the kid to say, all my parents are real. So, you know, those kinds of questions come from other kids. And so instead we would use language like first parents or birth parents language. The other tricky piece, and we'll talk about this more when we get to the faith communities piece, but there's also, I think, and I see this a lot, and again, it comes from very good intentions, but this tendency to emphasize the positive aspects of adoption and for family formation. You know, oh, she's so lucky to have you, or isn't it wonderful that you're adopted? And while there can be very positive aspects to adoption, and adoptees can be very grateful and like enjoy and love their family, at the same time, there can also be some loss, some grief, some difficult aspects to it. Adoption is just complicated. It's not such a easy wrap a bow on it kind of story for some people. And so instead, I would, if people want to compliment an adoptive family, I would just say like, you know, what a loving family, what a beautiful family, something like that would convey that message a little bit. Yeah. Are there other, I was curious, I wanted to check in, are there other language things that you hear around adoption that you think like, how does this land? Or, oh, I think this would be a problem if we said it this way.
I had the other day, my kids are both adopted and from Korea, and somebody said, are they brother and sister? And I said,
yes,
they are. That would be the older brother and the sister. Yep, they are.
Yeah.
But to them, then they're just reminded, that's not really my brother. That's not really my sister.
Yep, exactly. Yeah, that sort of conveying message that biological ties are better than adoptive ties in some way. Yeah, that's so insidious. And again, they don't mean it, but the impact is.
Well, they're just very curious, and I want to be like very curious about your personal life. Then it makes me like I'm very curious about your birth order.
Yeah,
I'm very curious about
I know.
Personal, like
yes.
You're asking DNA questions now. That's really personal, and you just met me, but.
Right.
I don't know.
Yeah. Tell me all about your conception, right? Yeah, exactly. I know. I have lots of good comebacks, but yeah, you always think about it more after the fact, right? When you have all your good comebacks. Yeah, good. So another piece I wanted to bring up are instructional implications. So things that would affect things in the classroom. One piece of this is just library and class materials. So I just always, when I'm in schools, encourage them, in a variety of ways to have your library reflect the diversity of people. But for adoption in particular, just to have books in the library, in the classroom library, that show the diversity of family forms. And to, both, it provides a bit of a mirror for kids who in the classroom who might be adopted. So if you have like a book that has a transracial family where different members of the family are different races or ethnicities, that's really valuable as a mirror. But it also can normalize adoption and foster care for the other kids in the class. So it doesn't become this like weird or unusual thing. They've read books about it, they see it, it's part of conversations. I put some links for some websites that have a number of books. I have on my website too, I picked a group of kids' books that I really like that I think do a nice job of dealing with adoption and foster care in a sensitive way. So feel free to check that out if you'd like some recommendations. The other piece, beside moving beyond books, is also projects that we assign in the classroom. And some of these are I think if folks don't have a lot of interaction with adoption or think about it, you might assign it unthinkingly and not realize the impact it has. So part of it might be, like, you can kind of read through the list, right? But some of it might be kids might not have some of this stuff. Kids adopted from foster care, from institutions, do not have baby pictures, do not have pictures often of themselves before a certain age. They might not even know their birthday, actually. Like they have an assigned birthday, but they might not know those things. And so doing an autobiography or a personal timeline, they're going to have huge gaps in that and just not know what to write. Even family history or family tree projects can be really problematic, but either because kids don't know some of it, or they don't, if they have an open adoption, which is more common now, how do they represent their complex kinship network on a traditional family tree? That's pretty tough. Do I just make it with my adoptive family? Well, then I've left out all my birth family. Do I do my birth family? Then I've left out all my adoptive family. So those kind of projects can be challenging to work through. Sometimes it's that they've experienced significant trauma that they remember. And so these projects serve as a trigger if they're asked to do a personal timeline, something like that. Again, as they get older and they're, in biology and talking about genetics, and then a teacher throws out a question of like, oh, so what have you inherited from, people in your family? And then there's this general class discussion about that. That's the adopted and other kids in the class might not have much to offer and might feel really kind of isolated for those discussions. Mother's Day, Father's Day, and birthdays I bring up more as triggers, I guess. So with Mother's Day, do you have opportunities for kids to make things for both? If they have an open adoption where they're actually gonna see their birth mom, do they have something that they can make for her too? Do they have to choose? Birthdays are a big trigger for adoptees, especially infant adoptees, because it often reminds them and thinks about, okay, what was my birth mother thinking about on this day, or what was she feeling? So there's often birthdays are really hard days for adoptees. Not all, this, a generalization, but just be mindful of the fact that a birthday might not always feel celebratory for adoptees. And then the last is a lot of, this is true for organizations, not just schools, but we have these like adopt a family or adopt an animal or adopt a highway project. And it conveys the sort of message that like we give money and we like receive something. And so for young kids, especially who think very concretely, these kinds of things, if they're adopted, that's gonna convey some challenges. So I would actually love to do just in pairs, or for those that are virtual, we'll do a breakout room in just a minute. I'll let Matt get it set up. I would love for you with a neighbor, and maybe we can do a group of 3 up here, to just pick 1 or 2 of these and think through what is the goal of that assignment, and is there a different way for us to achieve that goal that would be more inclusive for both adopted, foster, non-adopted kids. So you can pick whichever one you want on the list for your group, and then we'll just, at least for those of us in here, we have sound, so I'll be able to ask you kind of what you picked and what you thought about. So sounds good. Matt, how's the breakout rooms? All right, so virtual folks, you get to do this too. We'll come back in about 5 minutes. Idea that one of their group members or they came up with, we don't have to go in any sort of order, but yeah, maybe one idea from each group.
We had talked about, instead of doing the family tree, actually it's a all belong tool that we use, is the circles of like the people that I love, the people that I like, the communities that I belong to, doing something like that instead of doing a family tree.
Sure. Yeah, because it achieves that same goal of talking about relationships and who I'm close to. And yeah, great. I love that idea. Yeah. What about groups in the back?
We were talking about the student of the week and how that can be adaptable pretty easily. Like what you said, depending on what's being asked, and communication with the parent can help with that. Knowing as a teacher, parent relationship, knowing maybe a little bit of the background of what the story is there with the adoption.
Yeah, that helps a little bit, because then the teacher can know how to adapt in terms of what to ask them to bring in. And yeah, that's a good example of having good communication between parents and teachers. Gives you a little bit more detail about that. Yeah, for sure. What did you all talk about in the back there?
We talked about student of the week as well, and like being careful what questions you do ask, and maybe saying bringing things you like, or that it, express who you are, not necessarily just family.
Yeah. Good. Yeah, I've seen people get really creative with this. So instead of baby pictures, like draw a picture of yourself when you were a baby, like, which everybody can do. If you're looking for like specific take-home resources, I have 2 links in here, both of which have in their appendix, like they're kind of write-ups for schools, but then in the appendix, they have all sorts of replacement assignments for some of the common ones. So this is one of the family trees ones where for kids who have an open adoption, where they have contact with both birth and adoptive families. Sometimes they say they have the family or the kid draw some of their birth family and they're my roots, like they're who, and then my adoptive family's up in the branches, or sometimes they don't even separate it out. They say, here are the people that keep me grounded or rooted, so there's a really, a set of really nice, like easily printable free PDFs to replace a lot of the different assignments that we talked about. So I find those to be really valuable. Yeah, any other questions that came up as you were talking in your small groups about instructional implications before I keep going? Good, all right. We've been kind of hedging around this topic actually in a couple different ways, but I thought I'd be specific about this is this idea of microaggressions related to adoption. So microaggressions aren't specific to adoption necessarily. There's a whole lot of literature on race and ethnicity related to microaggressions. These are often these small comments that are made to people, not always intentionally to harm, often said with good intentions, but that land and have a negative impact for that person. And they tend to arise out of attitudes, at least for adoption microaggressions, in the general public, just about adoption, about family formation, cultural values around the family, like media portrayals of adoption and family. All of those things feed into these ideas that we have. And we all form these stereotypes, right, or beliefs about adoption, and they can come out in the comments and things that people say. So like that comment of like, are you a brother, are you brother and sister, right? That would be a good example of what could be considered a microaggression. Now, microaggressions fall on a spectrum, and so it's helpful, I think, to think about them in these different categories because your response might be different depending on where it is. So micro assaults we consider maybe the most severe form of microaggression. They are overt, they are conscious. The person, when they say it, they are attempting to injure, harm, or demean the person. So teasing that occurs between kids about adoption, like or really hurtful things that kids say. I mean, things like, your mom didn't want you, and those kinds of things that happen on the playground, that would be a micro assault. Those, I think, at least for me, I always feel much more comfortable, empowered, and easy to address in the moment when I see that happening between kids. I have more scripts, I think, for how to respond to those. They're much more clearly hurtful, and so it's a little bit easier to intervene, I think, as a bystander, or to avoid them altogether, like that you're not committing these. Micro insults and micro invalidations are a little trickier, I think. Micro insults devalue the person's identity or members of their group, so like other or adoptees in general. Again, they're not necessarily intentionally hurtful, but they do cause a negative impact. The research suggests these experiences accumulate. It's like kind of death by 1,000 paper cuts is what we sometimes say. Or micro invalidations are even more subtle, where they kind of invalidate the person's worldview or experiences. So let me give you a couple examples of micro insults and micro invalidations as a way to kind of understand these. These are from research that these are some of the most common ones that adoptees report experiencing. So very intrusive questions about their personal history. So things about why maybe they were relinquished, or, you know, what kinds of abuse or neglect experiences, or, you know, all sorts of very intrusive questions about their personal history. Asking adopted people to be the spokesperson for adoption. So asking them to talk about like, oh, well, what is it like? You know, tell me what what adoptees think about this. Well, I'm not the spokesperson, like I'm just me, right? Public outing of adoptees, meaning that like maybe in a setting where not everybody knows this one person is adopted, another friend kind of outs them before they get a chance to say that they are adopted. Maybe they didn't want to talk about that or reveal that part of their identity necessarily. Comments that convey that adoption is not normal or strange, that it's not typical. So I guess I would sort of classify our example we talked about earlier under that idea of like the biological ties are the normal, like that sort of a thinking pattern leads to some comments that convey that adoption is not normal for some reason. Talking about international adoptees as exotic, talking about and pitting adopted and biological children in the same family against each other in some way. We talked about this assumption of gratitude, this adoption is a win-win, you are lucky to be adopted. While some adoptees do feel that way, there's also other feelings they might have, and so it kind of invalidates that. And then also infantilizing adoptees. So this idea that when we talk about an adopted person, we're talking about a child. And here we are, because that's our focus, but there are a ton of adult adoptees. And so we always refer to them as, and think of them when we say adopted person and think child, that's not necessarily the case. It gets really tricky for transracial adoptees because they get the nexus of both racial and adoptive microaggressions. So they are more likely to experience microaggressions, period. And so I just want to convey how important it is for us to recognize when these are occurring and be an active bystander if we see it happening, especially between kids. Again, it's not always intentionally harmful, but it can be. And really apologize and repair if we're the ones committing them. We all make mistakes, right? We all say things that hurt people's feelings unintentionally. So it's more about being able to find a way to repair from there. Yeah. I was curious, do you see any of these where you think like, oh, that if I saw that happening between two kids, this is how I could respond? Maybe the overly intrusive questions, that's the one that happens a lot with kids. Yeah, so if you saw that happening between two kids, you know, what would be some kind of healthy ways to respond that wouldn't necessarily, would allow the question asker to save face, but also really protect the adoptee?
Well, the public outing one, that's pretty common. I think especially, well, it's probably across the board, but I see it a lot in adolescents. And we just tend to say, you know, that's their story. And you have your story, they have theirs, and it's their right to share it at their own comfort level. Some are eager and want to talk openly, and it's that they're at that particular point where they need to work their way through. And others really, like you say, want to just stay under the wire and not have it be a point of difference. So just letting it, like many things in life, this is part of their story. They get to share when they're comfortable. There.
Yeah, and I think that could work with intrusive questions too. Same sort of language. This is their story. They get to share. Yeah. Other thoughts on how to help kids navigate this when it's going down in the moment? Do you ever do like sort of separate discussions where you might approach the question asker or the comment maker separately? Does that tend to be effective? Yeah. And checking in then with the adoptee to see kind of their experience.
I think because we have 2 biological older kids and 2 younger transracial adoptions, the one about being viewed as having different status. So whenever my adopted kids hear that, so those are your real kids, that one I think is the unpacking with our kids later. I don't know that I have figured out how to talk to 7 and 8-year-olds who say that to them yet real effectively, because it's such an emotional reaction for me as their mom.
Yeah.
That and the lucky to be adopted one, because when you live with someone who lives with deep grief, I just always kind of couch that and like, I don't think you really understand how hard that might be.
Yeah.
So that to me is a circle back conversation.
Yeah. Figuring out how to do it in the moment is so tough, because there's like, you're managing a lot of different things, your own emotional reaction to it, the reaction of the person who was directed towards, like the status and feelings of the person who did it, especially if it was unintentional, and all the waves of it, right? Yeah. So these are a big deal. There's, I think, increasing focus on this topic, and looking at the impacts of it and how to really interrupt these kinds of things and repair them. There's no way to prevent these, altogether. Like this, people say stupid things, and I say stupid things, right? We can all own that a bit, but I'm hoping that with the increased attention to it, when I don't know what to say, sometimes I always just say adoption is complicated, and then I just kind of like in the moment, sometimes that's all I can get out. Yeah. All right, good. So let's transition a bit to thinking a little bit about this in faith communities, both in Christian schools, I'm thinking, and in churches. So there are actually a fair amount of references to adoption in Scripture, especially in the New Testament. That again, there's this sort of idea that adoption is used as a metaphor for salvation, that we're adopted into God's family, we're His children and heirs. And so there's maybe some of these Bible verses that some of us are familiar with. I've heard a lot of sermons on these, and often at baptisms. I don't know why that is. Maybe others of you have had that same experience. Sometimes there's more, again, people I think are trying to tell a neat and simple story about adoption, to say like, to adoptees, you're adopted, but we're all adopted by God, period. And then there's no more like conversation about that like the explicit message that adoptees are hearing is maybe a little bit more of a simple story that doesn't address some of the layers of complexity. So I thought it'd be really valuable for us to think about some of the messages that adoptees might be hearing in faith communities about adoption, about that narrative in Scripture, and how they might implicitly, like on their own, make some leaps or jumps that could be really harmful, both for their, like the way they see themselves, their faith development, all that. So I took some different themes from Scripture that I hear often in different sermons or contexts, and I thought we could do, again, a little bit of a breakout room, talking about each of these and really thinking through, okay, what message am I hearing? What message are adoptees hearing? What's the underlying message? So for each one, I want you to think, okay, if this is what the metaphor is in Scripture, and I just did a simple story that applied it to adoption practice, what would be the message about the adoptee, about their birth family, about their, birth culture, that kind of thing. So identify some problems with the simple story of just saying like, oh, this is what the Bible says about adoption, and same, it's just like that for adoption. So we'll do maybe 5 minutes or so, and then we'll kind of unpack this a little bit together. Does that sound good? Matt, did I give enough airtime for you to get those set up? Awesome. So great. So we'll do about 5 minutes again and come back together. All right, so let's come back together and just chat a bit. We don't have to do these in any particular order, but was there one of these that really sparked some discussion in your group about, oh man, if I think about that and just do a simple application, there's some problems there. Which one or one stood out for your group?
think kind of a big overlying picture of a lot of this is, you know, the redeeming factor that because of our sin, we are adopted, where adopted kids can't take on that perspective. Like it wasn't anything they did that caused the adoption. So that was the biggest red flag that we kept seeing through a couple of them.
Mm-hmm. Yeah, it really
Not because of
shames.
your sin.
Emily, could you repeat that into the microphone?
Yeah, for sure. The sort of this idea that adoptees maybe feel responsible or that they did something wrong to need to be adopted, right? And so it really shames and pathologizes the adoptee when we tell these simple stories and don't unpack them, right? A lot of times the shaming that comes is very implicit. Kids kind of hear these more simple stories in these faith communities, and then they sort of work it out in their own mind. And then there can be a lot of shame that comes from that. So yeah, it's not that they're conveying that adoptees, you know, like did something to deserve their adoption, but when you tell the simple story and you don't unpack it, that's kind of where some people end. Yeah. Other things you talked about in your group for any of these?
I think the other side of it too is that you're going into this, it's necessary because of our sinfulness and we're adopted into the family of Christ, and that you're in this like wonderfully safe place. And the reality is your adoptive family is also a broken group of people.
Yes.
And when you're a kid and struggling with both sides of that, like it's tricky.
Mm-hmm. Yeah, especially the sort of like gratitude piece, right? That adoption, this view that adoption fixes everything, and now it's a win-win. I should just be grateful. And sometimes there's more complicated feelings than that. There can be gratitude, and it's not like, it's both and. Yeah, other things that came up. Anybody? What did you guys chat about in the back?
Just discuss the same thing, like, it feels like if they were adopted, it's because of something that they did wrong.
Mm-hmm.
And that the only way to get to Christ is by being that, like, to be like adopted, to be adopted in a way that they see in a negative way, then they're going to be drawn away from Christ.
Right. Yeah. I think that there are real consequences for people's faith life, adoptees' faith life with all this. Yeah. A couple things I'll add that adult adoptees who've done writing around this kind of identify with some of these themes. I think we've kind of covered the first one in terms of what they say, but in terms of the sacrifice thing, it does end up placing the adoptive parent in the sacrifice role, which all parenting involves some sacrifice, right? Like I'm not negating that, but it does tend to ignore that simple story, ignores some of the sacrifices that adoptees themselves have to make in giving up like a birth culture, a birth language, access to birth relatives, those kinds of things. And it can kind of create this more naive assumption, because we are saved by Christ's love, that the adoptive parent's love will sort of fix everything, and there won't be, any more continued challenges or grief or those kind of things. And so that more naive approach is risky. It leads to adoption disruption and all sorts of things. In terms of this narrative of rescue, some things that come out of that are this idea that the ends justify the means for adoption. And so, yes, I'm rescuing you from this, horrible place. But at the same time, it's been used in some contexts to justify pretty unethical adoption practices. So after the Haiti earthquake, for example, there was some things that were publicized in the news about church groups that were trafficking children, and it came to be found, they do have living relatives. We just didn't connect them because of the chaos after the earthquake. But then they were kind of arguing, but we're rescuing these kids. So the rescue sort of it comes as an excuse to sometimes justify some problematic things. So we have to be that narrative of rescue. We got to be really careful of that, I would say. The gratefulness, I think we kind of talked about this, that it requires gratitude and it ignores that duality that's inherent in adoption. It can kind of invalidate experiences of loss and grief that some adoptees experience. And then this last one in particular, this putting off our old selves, like it outside of the adoption context, like that makes a lot of sense. But it really can put up a barrier for adoptees to think like, oh, my birth culture, my birth language, my birth relatives, I need to separate myself from that. Again, if we're telling simple stories and not unpacking it, it sends implicitly negative messages about those people. So yeah, so any questions about any of that? So I would just say I really caution people against simple stories about adoption in faith context. It can cause a lot of harm. I always really want us to think about the fact that adoption as practiced, adoption of children is really complicated. And there's a duality that's inherent in it. And you have to hold the tension of two things. Like adoptees can be very grateful and have deep love and affection for their adoptive family. And at the very same time, they can experience loss, deep loss and grief. And those two things don't cancel each other out in some way. It's not like a math problem where like, oh, I have enough gratitude and so I don't feel that loss, right? They hold both of those things sometimes. I love this book by, I'm going to say her name correctly, Kelly Nicodina. She's an adoptee herself and an adopted mother. So it's a great book called Adopted, the Sacrament of Belonging. And so I'll just read it as a way to kind of wrap up this idea. Adoption is complicated, as familiar with heartache as with hospitality, and over the time, stripped of all heroics, it can reveal humble truths. Belonging isn't easy or guaranteed. There are 100 ways it can go wrong, but there are as many ways as it can go right. As strangers are transformed into relatives, family formation is always a risk, but a worthy one. That's why we wrestle and contend for the blessings, as Jacob did in Genesis, to know the sacrament of belonging. This is how adoption works, like a sacrament, that visible sign of an inner grace. It's a thin place where we see that we are different and yet not entirely foreign to one another. We are relatives, not by blood, but by mystery. So if you want to explore these themes a little bit deeper, I really enjoy Kelly's work. The other resources that I would point you to are Sarah Easterly, Tiffany Hennis, and Camly Small. All of them have pretty good, pretty strong like social media presence too. So if you like to follow somebody and get sort of little bits, like if that's your preferred way of getting information, they are all good follows on social media. They have a variety of different articles that they've written about this. Sarah's memoir is really good. I think it's called Searching for Mom. Tiffany has a lot of like shorter articles that she writes. So all of these, I just really encourage us to listen to adult adoptees who have a lot to say about how these simple stories they've heard growing up have impacted their faith. They write eloquently about that. So we have a lot to learn. I have a lot to learn from them. So I'll just point out a couple resources and then I'll open it up to questions, maybe things that I didn't address that you want to ask about or say more about specific things. I have a couple resources available. So with the book that went around, I did a series of interviews with every chapter author about their topic because the book itself is expensive. And, not everybody wants to like sit and really read a textbook. And so these interviews unpack those topics in a more conversational way, and they're all free. So all the interviews are available as podcasts or as video. And so almost every topic that we talked about today, I have about a 30-minute interview with somebody about it. So like adopted microaggressions, 30 minutes on that, or academic outcomes in adopted kids, 30 minutes on that. So feel free to check it out. It's called Adoption Roundtable. It's on like Spotify and other spots. And all the things are on my website too, like all the transcripts for the interviews. And if you're like really wanting to get like regular things in your inbox about it, I do send out about once a month, I send out an email with like good resources I've found or articles or conferences or If I've done a new interview, I post it there. So if you want a more regular, like no pressure, but if you want a more regular interaction with this kind of content, that's a good way to do that. So yeah, I appreciate everybody's time, and I'd love to spend our last 8 minutes or so on any questions that you had for me about anything. I was so clear. This is like, yeah. Anything coming in on the chat, Matt? I'll wait and make sure. Feeling good. All right. Well, thanks everybody. I'll stick around up here for individual things if there's things you want to talk through, but I appreciate your coming and I hope this was helpful.
Yeah, and I just want to say thanks, Emily. I mean,
Sure.
I think we don't have questions because you covered a lot of the content that I was wondering about. I think you did such a great job of kind of laying the foundation, but it's also, I think, really great just to have space to think and to wonder about the things that we do on a regular basis, the words that we choose to use with kids, the projects that we may unintentionally have, and just to think about how to approach it. So thanks so much.
For sure. Thanks everybody. Yeah.
So we have a question here in the chat. Have you done any research about fetal alcohol or brain damage that is done even when kids were placed at birth with families?
Yeah, for sure. So there's a lot of research to suggest that even in like private infant adoption where there wasn't the experiences of abuse, neglect, or those kinds of things necessarily, that there can still be some of the risk factors or the outcomes that we talked about. So exposure to alcohol in utero generally increases risks for ADHD, executive functioning stuff, language stuff, social challenges. So a lot of the same outcomes that we talked about are relevant for kids with FAS. There's quite a bit of research with FAS and adopted kids. I have some kiddos that are in my teen social skills group right now that we're working with who have that risk factor. The locally, the best organization for that is the MC Fairs. I don't know how they do their acronym, but it's the Michigan Coalition on Fetal Alcohol Research and Education. So MCFARES is the Michigan one. And so they have local chapters and do quite a bit of education. The Post-Adoption Resource Center Park that's run by Bethany has a program next month actually about fetal alcohol syndrome and adoptees. So that would be a good resource for folks too. That's coming up next month, end of April. Cool. All right, yeah.